Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and Little Rock Public Radio.
And hello again, everyone. Thanks very much for being with us. The Sanders administration will try it again. A work requirement as a condition for Medicaid coverage. A regulation struck down in the courts under a previous governor. In a moment, the leaders at the Department of Human Services, who would be directly responsible for implementing a work requirement should it survive this time. First, though, we're a month into the regular session of the General Assembly. It's 95th General Assembly, and the legislative locomotive is at full speed now. One of the engineers joins us. He is Bart Hester of Cave Springs, the President Pro Tem. Senator, thanks very much for being with us.
Hey, thanks for having me, Steve.
As the Senate ended its work week, of all things, a tort reform bill goes through. It was a tight vote.
It was a really tight vote.
Couldn't get any tighter.
It couldn't. 18-17. I don't think either side thought it was going to be that tight, but it was. The business community wins on this vote.
Well, I mean, what made the difference this time? I mean, every session there's a tort bill.
Well, I think, every session there is a tort bill, and really I think just the argument that we see what's going on all across the country. States that aren't taking care of their businesses, which are the job creators, which our people work for, right? You got to have somebody you go to work for, right, that provides you these good jobs. States that aren't taking care of their business community are losing the jobs. They're fleeing to states like Arkansas. So we have to recognize that and say, look, we want to be a state where job creators come. And jobs follow those, and that's good for the working class family. That's good for the mom and dad. It's good for the kids.
Obviously, you voted with the majority, Senator. But 17 of your members, though, evidently sided with the argument that this is not going to be beneficial to the little people at all. It will augur against them.
And I will tell you that the trial lawyers are very persuasive, and they're very good at their job, right? And they've made some very strong cases. And look, I listened to the debate today, and I understand my colleagues on why they voted no. Just at the end of the day, I know how important it is to continue to tell businesses we want them to come to Arkansas. We're making a business-friendly environment because we want good, great jobs for the people that live and work here.
Of course, it's early in this. It's a month, but it's still early in the session, and the political climate, the temperature, would seem to suggest that the administration is likely to get whatever it wants, and certainly with overwhelming majorities, veto-proof majorities in both chambers, that your conferences, respective, are likely to get substantially what they want. Or am I off?
Well, you're not off, but I would like to say that the governor is getting what she wants because she's smart. She works with the legislature on what she wants. We develop a plan that we all can agree on. One of those things is cell phone bills or bell-to-bell cell phone bill in schools that we think is going to be really important in Arkansas, leading the nation in that issue.
Well, let me come back to that point later, if I may. One thing that evidently some of her critics in the legislature say she did not work very closely with, and that's the prison in West Arkansas. That's in your proposed prison. That's in your quadrant of the state anyway.
Sure.
What's the outlook there?
Look, I would argue differently. The governor and the legislature has been very transparent since she was elected. We're going to build a prison. We've set aside money for it. We've talked about the process. We've talked about the type of prison we needed. So we've been very open. The governor and her staff were very open about the areas they were looking at. But look, yes, the one thing they didn't say was this address. But that's a learned behavior, though, right? Like a learned lesson, not necessarily behavior. Anywhere in the country, if you say we're building one here, the pressure becomes too great and you end up not getting a prison, and we have to have a prison.
Some of your colleagues, sir, argue that the cost estimate on the administration's part was woefully underestimated, in a way that it could be as much as 3 times the expense just for the capital outlay.
Sure. Well, that's very hard for them to argue that because the administration has never had a cost estimate. It's never put one forth, never said about what it would cost. I've only heard the people opposed to this prison saying we're out of budget.
Well, the estimates were in the neighborhood of $400 to $500 million, and its opponents say no. I mean, based on estimates from similar projects in other states. It could be thrice that amount.
Sure. Well, how we arrived at that number was a few years ago we had significant budget surpluses, and we decided as a legislature, because we knew we were building the prison, we were very transparent about it, we set aside $300 million for that prison. That was just a first set aside out of some surpluses that we had. Then we were going to do, in addition to a prison in another spot of Arkansas, we had $170 million set aside for that. Couldn't do that addition because of some sewer utility concerns. So we moved that money over to the big additional prison. So we went from 300 to 470. That's how we got to that number. That was never this is the budget number we're working from.
Well, from this point, sir, this date, is a prison a done deal and that location a done deal?
The prison is a done deal. That location, as far as my opinion, is a done deal.
Okay. Medicaid expansion now. A big step on the part of the state. Are you satisfied that this time it will pass judicial review?
I do feel like we'll continue on with a Medicaid expansion in Arkansas. Look, it's very difficult to roll things back, but I think anytime you're going to be giving somebody something for free, I think you have to understand that. Okay, let's start that question over. I think
because I misspoke, Senator. I meant the work requirement, not the expansion itself. The administration has accepted the expansion.
That's right. On the work requirements,
right.
Look, the people of Arkansas are a very generous people. We want people that are absolutely in need to be able to get help. But we also think if you can work, you should be working. I think that is a bipartisan position. People don't want to be working and paying for somebody that's not working or not even attempting to work. So these work requirements aren't as difficult as they look. We want you to be working or trying to work or trying to educate yourself, that we will help you educate yourself to get a job.
There is some concern among providers, Senator, that the work requirement, even if it is held to a minimum, could have a pretty deleterious effect, particularly in rural areas of the state, on small hospitals, clinics, other providers. Your thought?
Oh, I think that's absolutely possible, right? Look, we have to take care of our rural hospitals, but I think if that needs to happen, it needs to be on an understanding of what we're doing. If we need to subsidize them in some way, because we need hospitals in rural Arkansas. If we're gonna do that by just writing an annual check, or if we're gonna do that by running it through Medicaid, that's a decision that we want to make. I'm comfortable making those decisions. I just want to be eyes wide open when we do it.
As the session ended for the week anyway, at least on the Senate side anyway, the administration, the governor, unveiled her program for maternal care. Your first thoughts at it?
My first thoughts are, here's Governor Sanders tackling another difficult issue where Arkansas has been at the bottom of the pile for a long time. I'm proud of her for continuing to lead. She's leading on the difficult issues, and they're difficult. We're at the bottom of the pile because they are hard, right? And we haven't taken the time or focus to get Arkansas from the 45th or 50th state in this issue. She's taken on another tough issue. We're going to see real results.
Well, at first glance, sir, and I just had a moment to review it, it appears that she is not including what Mr. Pilkington, Representative Pilkington, has long advocated rather forcefully, and that's an expansion of the Medicaid program for postnatal delivery for 1 full year. Would you advocate that? I mean, would you support that?
Well,
would you advise the governor to think that through again?
Well, I'd absolutely advise the governor in making sure that our moms are being taken care of, and that could be meaning that we're going to do it through one additional year after birth of Medicaid, and it could be through some other form. Look, one thing I appreciate about Governor Sanders is she always has a creative way of doing something. So I will lean on her to make sure we're taking care of our moms. It may not be necessarily through Medicaid.
Well, lean how now? Share
well,
it with
okay.
us.
Oh, that's great. I'll tell you, at least once a week, I have a one-on-one meeting with the governor. We talk through all these issues, right? We don't have to do it in the paper. But look, I know what's important to Arkansas. I know what's important to the governor. I know what's important to this legislature. Taking care of our moms and our babies are it. And when the members are understand taking care of mom from birth to 1 year is part of making that successful, we're going to do that.
Okay. 2 weeks ago, in that very chair, your counterpart on the other end of the Capitol, the Speaker, suggested that he thought the governor might be willing to accept that expansion.
And that very well may be the thing. If that's what the governor wants to do and that's what the speaker wants to do, I will tell you that's 2/3 of the say, right, within leadership. But, you know, I don't know exactly how that's going to go. Again, it very well may be the case. We'll see what happens.
The economy remains strong and collections pretty well reflect that anyway. Even with the tax cuts, you're going over expectations anyway, with the exception this past month of sales tax revenue. With the state's anticipated outlays, are you concerned at all about the revenue with the LEARNS Act coming up, the expansion about to take effect? You know, voucher expansion.
We're always concerned about the budget, right? That's why we're not leading this session with more income tax cuts. We're going to wait and get closer to the end of session or closer to the end of our fiscal year, which is in June, before we cut more taxes. The governor, she was elected by the people on saying that she wanted to work towards a 0% income tax rate. We've been doing that, and while we're doing that, as you just said, we continue to have increased revenue and surpluses. I suspect we'll have $250 to $300 million surplus again this year, even with all the cuts, and what I would say more importantly, continuing to provide the services the people of Arkansas expect.
Well, she's estimating $300 million, right under $300 million at the end of the fiscal. Realistic?
I think it's very realistic. And look, here's one thing we've always seen. Since I've been in the legislature for 12 years, the governor's office and DFNA are very conservative on the number. We usually say 250 or 300 million. The day you get out of session, that number grows because they don't want members to think we have $500 million or something and want to spend that money. I don't know that that's happening. I'm just saying that's the case over about 12 years as far as I'm in the legislature.
Income or grocery this year?
I suspect we will do income tax cuts, and I suspect we will do grocery tax cuts. I suspect we'll do the grocery tax cut in this session, and we'll cut income taxes in a special session.
Okay, you're a former Razorback, so this is straight answer now. All right, opening season for the only sport that really matters,
right,
is a week from today. So
that's right.
Your outlook for the season?
Well, look. I've never seen a team, if you just look at those guys even on TV or something, they look like a bunch of action figures out there. I mean, these guys are specimens. They're doing special work. I suspect we'll be in Omaha, and I hope we bring home a title this year.
Mr. President, thanks for coming in as always. Come back soon.
Thanks for having me.
Okay. We'll be back in just a moment. And we are back. Almost a dozen years ago, or approaching that, under Governor Asa Hutchinson, Arkansas was the first state to establish a work requirement to receive Medicaid benefits. The first Trump administration approved the rule, but it was soon enough struck down in the courts. Now the second Trump administration is expected to approve anew the program, requested by Governor Sarah Sanders, although challenges in the courts and perhaps on Capitol Hill are guaranteed. Joining us now, Kristi Putnam, Secretary of the Arkansas Department of Human Services, and Janet Mann, who is Director of Arkansas's Medicaid program. Thank you both very much for coming aboard the broadcast. Secretary Putnam, we'll begin with you. What is different from this version from the one that was tried in 2018?
Sure, and thanks for having us on, Steve. So there are a couple of key differences. One major difference is that we are not making a work requirement a condition of eligibility. It is something that participants can participate in and continue to be active in their qualified health plan, their coverage. Instead of disenrolling them for not participating, their benefits would be suspended. So they would still be eligible for Medicaid. They would still show as eligible for Medicaid, but they would be suspended from their qualified health plan benefits. And so that is one of the key differences. Deputy Mann, would you like to expand on that?
Thank you. So I think another key difference is lessons learned from the first work requirement was on the reporting and the communications. So in this waiver amendment, we are going to exercise lots of technology for matching of community activities and work options, and then try to work with the beneficiaries and not have them have a monthly reporting option, which was reported back to us as heavily burdensome. In addition, I think the communications with the beneficiaries in various forms, be it telephone, social media, text, email, would be more beneficial this time around than what we had used previously.
Yeah, the execution of the screening process in 2018 was widely faulted by many consumer advocates anyway. What changes have you made? What guarantees do recipients have that their voices will be heard, that their information will be recorded accurately?
So that's one of the things that we've tried to address in this waiver amendment is working with data and then working with our sister agencies and community partners in really using the local touch of what our beneficiaries doing every month, every 6 months, or annually. But the best thing about this waiver amendment is we have approached the concept, data matching and working with our partners in the local communities, and then to fine-tune the details, we will negotiate with the Trump administration for those terms and conditions in this waiver amendment.
Well, a core issue in any in a work requirement situation would seem to be as much philosophical, well, both philosophical and fiscal, in terms of whether this is, a program that should be means tested the way the state is proposing to do. Secretary, Madam Secretary?
So it's means tested is different from applying a work requirement. We have a number of means tested or income-based programs that already have a component of a work requirement. SNAP has a requirement for able-bodied adults without children to have some sort of qualifying work or education activity. The Temporary Assistance for Needy Families program, or TANF, also has a component. So really, Medicaid is an outlier in this regard. And, we are viewing it as, it's something that can be streamlined to complement the other programs that have a work component to them. And we're looking for ways to find efficiencies so that we can leverage resources across all of these programs, really to encourage individuals to engage in some sort of an activity that's not going to be just a job. I think that's a big delineation that we'd like to make. Is we don't want this to be just a job. We want it to be a career path for individuals. So I think that's one of the big differences. It's not just a means tested. Means tested is income. This is a work component that already exists in many of our other programs.
How many present recipients would you estimate? Do you have what you think is a firm estimate or a good estimate of how many individuals would be immediately involved or affected?
We do not. So in this proposal, we are proposing the entire population in the Medicaid expansion population, which is 19 to 64. There are currently about 220,000 individuals enrolled, and that changes every month. So we will be working with all of them to work on this community engagement and work requirement, but we have not drawn any estimates as we are waiting on public comment so that we can submit to CMS and then begin negotiations.
So is there a sense of or an estimate of the overall fiscal impact then?
No, sir. Without being able to estimate the eligibles, we cannot apply a fiscal impact to that. But we do know that people are happier and healthier when they are going to work, and they have better mental health outcomes when they are either seeking community engagement or a work opportunity. So that's what we're hoping to see as one of the outcomes in addition to maybe better opportunities for their careers.
Yes, on the fiscal impact, I think there's a tendency to focus on the fiscal impact of people no longer being part of the Medicaid program and what kind of savings is there. But I think it's important to look at the flip side of that. If people are moving out of Medicaid eligibility because they have gotten a job that is a really a living wage and they're qualifying for employer-based insurance, they are now making more, and there's a positive fiscal impact to the state overall because they are taxpayers, they're contributors, they're out in their communities. And so I think, focusing on both aspects of fiscal impact here is really critical.
And that is why we named it Pathway to
Prosperity.
Prosperity.
In terms of fiscal impact, the immediate fiscal impact, could it not be, would be to providers, particularly providers in rural areas where they're already, the margins are pretty thin?
So I think, that is part of what we will be working through for implementation purposes, is that we do intend to leverage a support network, and it is very much about engaging with the community level resources that already exist to make sure that those individuals are not simply disconnected from coverage, but they move into a different coverage. And so if someone moves from Medicaid coverage into commercial insurance that's sponsored by an employer, or even that's a marketplace plan that they've purchased with a subsidy from the federal government, those commercial plans actually pay providers a better rate. So in the end, providers could stand to be better off with this approach.
What is the concern, or level of concern, if that's the term, that a great many individuals who will start going to emergency rooms for treatment as opposed to just routine general pediatric care or general practitioner care?
So I don't think we have factored in any type of outcomes based of anyone that would move from Medicaid covered insurance to a different type of insurance. We do think it will be a net neutral to the communities if they have Medicaid coverage and they move to an employee-sponsored coverage, and it would make them more active in the community. But to make estimates on a potential impact to an ER versus a provider, we have not done that analysis.
Will there be any kind of structure or a network to provide services like child care, transportation for recipients who will enter the program?
So that's part of the leveraging existing resources that we will work on building out as we go through the planning and implementation phase, both with our team here at DHS and sister agencies, and also with the Center for Medicare and Medicaid Services. There are options already available for child care and transportation. There are gaps, and we know that there are gaps in both, but it would be making sure that people get connected to what does exist. And then, of course, considering extenuating circumstances where an individual does not have that access is something that would be, considered for, do they need to have a pause of that requirement that they have?
Okay, as I understand it, the program will not be fully operational anyway until next calendar year anyway, or calendar or fiscal, either way. What's the delay here? Just approval for CMS?
Yes, sir. So there's we have a 30-day public comment period going on right now at the state level. That's a requirement through state law. Those public comments will be answered and then packaged with the waiver and submitted to CMS. CMS will do an additional 30-day comment period at the federal level. Then we will begin negotiations to finalize the waiver, and then there are system changes that will have to go into place, and then there will be an entire outreach and communications plan. So really the goal of 1/1 of 26 gives us the time to plan and have this spread throughout the entire state very thoughtfully and complete.
Let me shift gears, if I can, for just a second. The governor announced on Thursday, unveiled on Thursday, her maternal care program. Is this a major breakthrough?
It's a major breakthrough.
Yes.
It was an exciting day for Arkansas. So the governor, in her budget, gave the Division of Medicaid $13 million extra, and with the matching with the federal government, we can turn that into $45 million annually, and we're going to use that to pay providers better for deliveries and C-sections and regular deliveries. Also pay for additional office visits and lab work and things that they need. The whole goal here is prevention. Have a healthy mom and have a healthy baby. So by moving upstream and trying to open up access to care, then pregnant moms across the state can have better care. In addition, we're going to implement presumptive eligibility for pregnant women, and that is a short-term option for when pregnant women find out they're newly pregnant. They can go to the doctor while they're working on their Medicaid application and then not have a break in their care. So we are very excited for this. This has been, almost a year. The governor signed an executive order in March. Mm-hmm. The Maternal Health Committee was created and produced recommendations in September. And now, the very 1st of February, we are looking at legislation to put those recommendations into place. And that is not all that's been done. There's been, several other areas of education and outreach done, and data and reporting. And so we're just getting started.
We've got just a few seconds remaining, but I would note that it does not include the 1-year extension of Medicaid for postpartum care.
It does not.
It does not, because Arkansas already has coverage for women once they move past the 60-day postpartum period. So what it does include is additional outreach methods for us to work with women during that 60-day postpartum period to make sure that they're connected either to Medicaid if they're eligible or to another version of coverage in the state. But we do already have coverage for that.
Got to end it there because we are simply out of time. Madam Secretary, Madam Director, thank you very much for being with us. Thank you for your time. Come back soon.
Thank you.
Thank you.
And that does it for us for this week. As always, we thank you for watching and see you next week.
Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and Little Rock Public Radio.